professional before you try anything new. But today we're going to talk about some general stretches that you can do to help yourself with back pain. And please stay right till the end of this webinar today, because it'll be important for you to get the special offer that we have at the end of the webinar. If you're in the Kelowna area, we do have a good offer for you. If you're not, I'm still willing to help you to find a health professional that can help you with your back pain in your area. Just a quick question for you. Have you seen a chiropractor for back pain in the last 12 months? So please type in the chat, just leave a message there letting me know if you've seen a chiropractor over the last 12 months. I'm just curious. Or if you're on Instagram, you can type in the comments and leave me a note or DM me. Now, the reason I'm doing this webinar today is our mission is to change and save lives in our community. And we do that through chiropractic care. Beyond our community, I want to reach out and educate people about what you can do to help your back and how you can reduce pain and increase flexibility, get your quality of life back. So that's the goal of today's webinar. My qualifications: I've been a chiropractor for over 30 years. This is my 30th year, actually. And I've seen over 10,000 patients in my practice. Most of those patients actually came earlier in my career when I was doing locums. So when I took over for chiropractors in my first 3 years of practice, I saw so many different patients. It was really a great experience because I learned a lot. And then since then, I probably saw a few thousand patients early in my career. And then since then, I've been seeing patients at my clinic in Kelowna. I also wrote a book about back pain. So if you do have back pain, this book is on Amazon, and you can get that in an ebook. You can get that in paperback and audiobook format as well. Just a disclaimer that the information provided in this webinar is general information. It's not medical advice. So make sure you check with a healthcare professional before you start something new. Now, my story. I started with chiropractic care as a teenager. So I was a young teenager and I was having a lot of knee pain, and my parents took me to our family doctor, and our family doctor checked my knees and said it was growing pains and I would grow out of it. But my knee pain persisted, especially if I fell on my knees or bumped a desk in school or something like that. My knee pain was pretty bad, pretty excruciating. And my father took me to a chiropractor that was at our church. And the chiropractor examined my knees, took x-rays. He was the first one to do that and diagnosed my knee condition correctly. And that was really an eye-opener, because that really helped me to overcome my knee pain, improve the strength of my knees, and get into things like running. And I've run over 20 events now in my life, half marathons, full marathons, 5 and 10K. I've also played a lot of sports like hockey, golf, and the chiropractor really helped me. So that inspired me to become a chiropractor myself. 3 things you need to know today are how to reduce your pain, how to improve your flexibility, and how to do a simple and time-effective routine so you can do this on a daily basis. So I want you to be able to do these exercises on a daily basis if they're suitable for you. So the first exercise that I want to go over is called the cat and the dog. Some people call it the cat and the cow. And you want to alternate between this position, which is a flexed position for the back. So your head's down and your back arches up towards the ceiling. And then just hold this for 1 to 2 seconds. And then you want to go in the opposite direction. Head up, back sags down, and then that's going to give you the opposite stretch. So this stretches the muscles, ligaments, and discs on the back part of the vertebrae. The other one, when your head's up and your back is sagging towards the floor, that's going to stretch the ligaments and the discs on the front part of the vertebrae, what we call the anterior part of the vertebrae. And on that one, I would alternate, sorry guys, I would alternate on this one 8 to 10 times. I would hold for 1 to 2 seconds in between the transitions, and I would keep going from that cat to that dog position back and forth. The next exercise is the hamstring stretch. Because the hamstrings attach into the pelvic area in the ischial tuberosity in the back, I find a lot of patients have tight hamstrings, which can change the alignment of the pelvis and then strain the lumbosacral junction, which is the where the lumbar spine joins with the hip region. A good way to stretch the hamstring is to stand like this and just bend forward. I wouldn't lock the knees. I would keep a slight bend in the knee, but bending forward at the waist like this really stretches the hamstring, and it'll help to relax your hamstring. You could do this in a lying down position as well. So you can do this lying on the ground, and then you can bend your knee and use a towel to pull your leg towards your chest. You could also do this in a chair, pulling your leg up towards your chest with your knee. So there's a number of ways to stretch the hamstring, but stretching the hamstring, holding this position for 3 to 5 seconds, doing this 8 to 10 times can really help to relieve the back pain associated with the hamstrings and the lumbosacral junction. Child's pose. I like this one. Now, if you have sore knees like I've had in the past, and maybe they don't bend as far as you want them to, having a little wider position for the knees is okay with this one. And so you just want to get your knees on the ground. You want to go into this flex position, and you want to go parallel to the floor with your arms overhead, just holding this position for 3 to 5 seconds, flexing at the waist, and that's going to help stretch out that lumbar area, the lower part of your back. So that's going to just help to open up the disc spaces, relax the muscles and the ligaments. And it's going to help with the treatment that you're getting from your healthcare provider. Rotation. I really like rotation, especially for discs. So as your disc condition starts to improve, your chiropractor, or if you come to my clinic, I might give you these rotation type of exercises, and having one leg crossed over the other, the opposite elbow goes to the knee, and then you just twist in the opposite direction from the way the knee is flexed over. And then I would hold this for about 3 to 5 seconds, and then slowly unwind the position and do the opposite way. And do that for about 3 to 5 seconds, and do 8 to 10 repetitions on either side. That should take you approximately a minute to go through that. Maybe a little bit longer for this one. For shoulder blade exercises and the upper part of the back, have your arms up overhead like this. Squeeze your shoulder blades together in the back part so the scapula come together, and just hold that for 3 to 5 seconds, and then relax, and then do that again. Do 8 to 10 repetitions of this with your arms up overhead, reaching up towards the ceiling. If 3 to 5 seconds is too long for you guys, you can just hold for 1 to 2 seconds. It's good just to get that contraction of the muscle and then the relaxation. If you're interested in the book that I've written on back pain, I'm going to put a link in the show notes right here. And I'm working on a second edition to this book. Hopefully that'll come out in the coming months. But right now, if you're in the US, click on the link that says US Amazon. If you're in Canada, click on the link that says Canada, and you can go directly to the book. And there's the 3 formats: paperback, ebook, and audiobook on Amazon. If you need some more help, I'll put a link right here for 25% off your first visit at the clinic. So if you're in the Kelowna area, here's your link to get 25% off. Now, if you're on Instagram or social media and you're watching this, click on the link in our bio, and then go to first appointment, and where it says coupon code, type in 25% off neck pain webinar, and then you can book an appointment there. If you're not in Kelowna, I'm going to give you a link, and I'm happy to do a consultation on the phone, or we can always use Google Meet or Zoom, and I'd be happy to talk to you and refer you to somebody in your area that can help you with your back condition. So please use the link right here for that. Now, if you're interested in more information along these lines, then I do have a masterclass. And for the masterclass, I will go more in depth into what we talked about today. So basically, it's a self-study course. It's a 5-week course, so 5 modules once a week, and you can take this at your own pace. And I'm going to put a link right here for that. There is a coupon code for 25% off for the next 7 days. So if you click on that link right there, you'll be able to access that special offer. And then take the masterclass on how that can improve